Hi, I'm Gene McLaughlin. I'd like to welcome you to Old Bridge Outlook with Mayor Owen Henry. On this program, the mayor has an opportunity to chat with you about things taking place in the township and to introduce you to people making things happen in the township. Mayor, how are you today?
Hello, Gene. Thanks for having me.
Good, Mayor. Nice to have you. And folks, we're also delighted to have our special guest today, a lady that is from the Middlesex County Office of Health Services, Sherie Wolpert. She is an epidemiologist and master of public health, and she's going to be talking about a topic that's been very much in the news lately, and that's the Zika virus. And Sherie, I want to welcome you.
Thanks, Gene.
Okay, thank you, Sherie. And if you'd give the mayor and I a moment just to chat about one or two things that have happened. Mayor, last council meeting, COA, affordable housing, what's going on?
Well, anyone who's going to be tuning into the council meeting that is coming up, you'll see a big discussion in reference to COA. COA has been with us for a long time here in the state of New Jersey. It's been in Old Bridge for a long time. It was put on the back burner a few years ago when the governor challenged COA and kind of put it in limbo. Since then, the Supreme Court has ruled that it is going to happen here in New Jersey, COA, the Coalition on Affordable Housing, which requires towns as they develop to maintain a specific number of affordable units or houses or apartments or townhouses, that a certain number be dedicated affordable, made affordable, so that seniors could live, can stay in the town. That development wouldn't force people out of the town and wouldn't prevent people from moving into the town. The housing stock here, not only Old Bridge, but every town in the state of New Jersey has to maintain a number. And everyone can have an opinion about COA.
Right, they do. Everybody does.
As a person, I believe in the concept. I can say I'm disappointed in the way the state has applied the concept in round 1 and round 2, which Old Bridge has been compliant.
Right.
Round 3 is now what we're talking about, which brings Old Bridge commitment out to 2025. So
really, that far out?
Years.
Wow.
So you're going to be, and it's a very complex formula that's come up. The council is going to be discussing a settlement agreement where the town had a say in where these units go or homes, where they go, who builds them, where they're built. I've said that already.
Right.
And we've had an opportunity to negotiate the numbers.
Okay.
We've gotten credits for seniors. We've gotten credits for veterans. We've gotten credits for apartments as opposed to single-family homes. So the town has negotiated a settlement with the courts that now the council will have to approve the settlement. Not approve it.
Right.
It's going to be a heated discussion.
I'm sure.
It's one of those things, I'm not going to call it a no-win situation. It is a win situation, I think, for everyone. I think the settlement that has been discussed is something the town can manage over the next 9 years. I don't know if the town would benefit from builder's remedies, as they're called. If the council was to vote no and not accept the settlement, then we'd be exposed. The town of Old Bridge would lose any type of immunity. We are now not involved in negotiations. Builders and the judges.
So it behooves us to approve this, is what I hear you saying.
I believe in the concept.
Right.
I believe Old Bridge needs to take care of the people that are in Old Bridge and want to stay in Old Bridge, and I believe we should have housing options for people who want to move into the town. We should not exclude. Old Bridge is known for its diversity, and we should maintain that. And this was brought. It's one of them, civil matters where a lot of times the majority does not rule.
Right.
I mean, if you ask the majority of people in Old Bridge, maybe this is not. They wouldn't want COA, but COA is here. It's the law. As we all know, laws are a feeble attempt of man to try to make us all
get things organized.
Organized
Yes.
and decent people.
Okay.
This is one of those issues where, I believe in that we need to make, but at the same time, it can't have a negative impact on the community. And I don't believe that this settlement agreement is going to have a negative impact on our community over the next 9 years. I do believe that builder's remedies might have a negative impact. So we'll see.
We'll see.
I'll make my opinion. I don't have a vote. I'm just the mayor.
Right. You're just the mayor, right?
And and the taxpayers are going to be responsible for footing the litigation bill. So let's put it out on the table. Let's see the reaction we get from the people, and we'll move forward either way. The world will not stop spinning.
Mayor, I see there's another reason for excitement here in the township. Some trees are going down on Route 9 and 18. We're going to have a hotel.
The hotel has broken ground. Finally, it was a battle, both for the township and for the developer. I mean, there was an objector who took every step he could to appeal any decision that a board made here in Old Bridge to stop the construction of that hotel. But as you said, Gene, it's being constructed as we speak now, and it's probably going to be about a 12-month build-out period for it.
Good
We're
news.
excited about that. 100-room hotel. It'll be the only hotel in town, but I'm sure once that one's done, more will follow, because that's what the competition.
That's right. That's
so
right.
They have to come now, and we certainly, I believe, have the base for a hotel. We have some large banquet facilities in town with no place to stay in town. We have, nationally, Raceway Park has a big event once a year where people from all over the country come to Old Bridge, and there's no place to stay. Right. So we're excited, and I think it's a really good thing for the town. The hospital,
I think it's a great idea.
It's finally, it was a long time coming, and finally it's done.
It's done. Okay. Well, Mayor, I think it's about time that we turn to our topic of the day. And folks, as I introduced at the beginning, Sherie Wolpert is from the Middlesex County Office of Health Services. She's an epidemiologist, and we're going to talk about Zika virus. And Sherie, again, welcome.
Thanks, Gene.
Sherie, if you'd be so kind, for the benefit of our viewers, what does an epidemiologist do?
An epidemiologist tracks trends of diseases in populations. We look at where they exist, how they exist, who gets sick, who doesn't get sick, and we do investigations of diseases in populations.
Okay, now tell us about Zika that is introduced into the country rather dramatically in the last couple of months.
Okay.
What's going on?
Well, first of all, you and people in Old Bridge might have seen that there's been a board at the library in Old Bridge. Our department put a big board on some Zika information at the library, and somebody from our department spoke at the library also on Zika. Zika is a virus, mild in most people, that is transmitted primarily through the bite of a mosquito to a human. That's primarily the way people get Zika. Most people have just heard of Zika in the last several months, but Zika has actually been around since 1947 when it was first discovered in Uganda. It was discovered then, and in 1952, the first person got Zika. And then there's been sporadic cases of Zika in Asia and Africa up until 2007, when it hit in Micronesia in the Pacific Ocean. And then since 2007, there have been more widespread outbreaks. Still that people hadn't heard about until it hit Brazil in 2014. Right.
How is it basically transmitted?
It's basically transmitted through the bite of an infected mosquito to a human. There are other ways to transmit it. A mother can transmit it. A pregnant mother can transmit it to her baby, and it's also transmitted through sexual contact.
Okay, and the business with the mother communicating it to the baby or conveying it to the baby, what does the mother do, a pregnant woman, do in this situation?
Going back prior to that, there's the CDC, the World Health Organization. All health organizations advise pregnant women not to travel to places where Zika virus is active. So that would be the first advice we would give to pregnant women. Don't even go to places where there's Zika virus. If you have to go to a place where there's Zika, where Zika is active, contact your doctor or a public health professional before you go, so you can get information on how to avoid getting bit by a mosquito. If you come back and you suspect that you have gotten bit by a mosquito, or you suspect for some reason you have Zika, you should contact your physician, follow up with tests, and make the best choices you can between you and your physician if you're pregnant.
Okay, to that point, you mentioned off the air, though, that the transmission of it is relatively limited. Sherie, would that be accurate to say in the United States there's been only several thousand diagnosed?
That's correct. As opposed to other countries where you hear millions and things like that. In the United States, there have been a little over 3,000 confirmed cases of Zika, and those are all travel-related cases.
Right.
Now, there's a handful of cases that are the difference between a locally transmitted case and a travel case is if there is a Zika mosquito that lives in your area that has Zika, that's a local case, as it is with some small areas in Florida where there are Zika mosquitoes.
Right.
So the only place where there's local transmission in the United States is in Florida. So the 3,000 cases in the United States are all from travel-related cases, except for the Florida cases.
And in New Jersey, we only have what, about 128, I believe you said?
There's 128 confirmed cases of Zika from the time they've been counting cases to now.
What do we do about diagnosing it or, picking it up in advance, or any way to diagnose it?
There's ways of diagnosing it through testing at a certain time that a person has it. So Zika stays in a person's blood for about a week, maybe up to 3 weeks. And so you can test a person for a certain amount of time, and a person has to meet certain criteria, but there are tests to diagnose Zika.
Okay, what would the symptoms be if I was to get it, the mayor was to get it, a non-pregnant woman gets it? What are the symptoms? What do you look for?
The symptoms are a fever, a rash, some joint pain, and conjunctivitis, which is a redness in the eyes. Let me point out, though, that only 20% of people who have actual Zika virus have symptoms at all.
Really?
And most of the people who do have symptoms have very mild symptoms, and they usually go away within a week.
That's what I was going to ask you. The duration's only about a week. You only have the symptoms with you for a week or so.
Yes.
Okay, well, thank you, Sherie. Folks, we're getting ready to take a break right now. If you'd be kind enough to stay with us, we're talking with Sherie Wolpert about the spread of the Zika virus. She's an epidemiologist from the Middlesex County Board of Public Health, and she'll be back in a minute with us.
Don't worry, 74 people were picked before me in the NFL draft.
To fight childhood obesity, United Way and the NFL are helping kids play at least 60 minutes a day.
Okay, time for the team obstacle course. Yay!
What this place needs is more healthy kids. To get involved or donate, go to unitedway.org/play60.
Now I get it.
Why is Connor having trouble focusing in school?
Having trouble finding Connor's middle school? Would you like directions?
No, why is Connor having trouble focusing in school?
Finding lowest airfare to Istanbul.
No, I'm tired of fighting with him over homework.
Home, walk, restaurant. Need a review?
No, I need help. He's very smart, but his mind wanders. He's disorganized.
I think I understand.
Oh, good.
French fries. Finding best potatoes.
No!
Russet. Fingerling. Yukon Gold.
Why don't you understand me?
Sorry, I was trying to show how Connor feels every day. Frustrating, isn't it? Redirecting to understood.org.
For the 1 in 5 kids with learning and attention issues, this is what life can feel like. Explore understood.org, a free online resource about learning and attention issues, designed to help your child thrive in school and in life. Understood.org, because understanding is everything.
Welcome back to Old Bridge Outlook with Mayor Owen Henry. Before we went to the break, we were talking with our guest, epidemiologist Sherie Wolpert, about the Zika virus. Sherie, when we were close to the break, we were talking about the fact that the Zika virus is not a serious matter for those of us who are healthy or not pregnant. Short duration, mild symptoms. Pregnant women, a whole other story.
Much different. In pregnant women who have Zika, there's a link between Zika and microcephaly in their unborn baby. So, I'm sure many people have heard different things as our information on Zika gets better, and as we learn more and more, the science changes a little bit. So, we're at a point where scientists have been studying it longer, and so more is known. Still, there's a lot unknown. So what I'm saying is what we know at this point. So there's a very strong link between birth defects in babies born to mothers who have Zika. So microcephaly is when the brain, when the skull is small, and thus the brain is
we've
small.
seen those pictures. They're very heartbreaking.
Yes, they're very sad, and they're very
Yes.
It's very, very heartbreaking. But the brain doesn't develop.
Yes.
Also, because the brain is very small, and so there are other defects that accompany that usually. So these are babies born with severe brain defects and other birth defects usually.
What kind of mortality is associated with these babies? How long do they live?
I don't know that there's a time on these because microcephaly has been around a long time. It's not new to Zika. And so
it's not only caused by Zika.
No,
it can be caused by other events.
No.
Okay.
And actually, that's how they knew about the rise in
Yes.
Originally, they saw the link between Zika and microcephaly is their number of those birth defects rose.
Right.
So they had that birth defect prior to Zika. So yes, it's caused by other things.
Okay, that explains a lot, Mayor. That clarifies a lot. What are we doing about treatment? Do we have any kind of vaccine in the works right now that can prevent this?
Okay, there are several groups working on a vaccine. I think they're working fast on a vaccine, although vaccine development is a slow process. It has to go through, before it even gets to human testing, it has to go through various processes. So I think the initial stages were encouraging, and they are working on a vaccine, but there is no treatment. The treatment, you just treat the symptoms, supportive therapies, fever-reducing medications, sleep, rest, hydration, things like that, supportive therapies, and it's a mild illness usually, so you just treat it that way, but there's no specific treatment.
Vaccine.
It goes away by itself.
Definitely something to be looking at and working on, though, I'm sure.
Yes.
And the major drug companies, I'm sure, will get involved if this is a crisis. Mayor, we have talked off the air, and Sherie and I had discussed, too, a lot of education involved here. And I know the township has been doing a lot. I know Sherie can talk about it. What have we been doing here, Mayor, in the township?
Every year we fight the mosquito problems here in Old Bridge. But this year it's been extra, like you said, the spotlight has been on it because of the Zika. So what the township has done, we've become the front line. We go out and we try to find areas in town. We've called, I've reached out to the public for help, and boy, they have responded. They've reported every puddle of water, every unabandoned pool here, and then we rely on Middlesex County to come and treat those areas and we take precautions. We will find the homeowner if they don't resolve the issue.
Oh, really? I didn't know that.
Yeah.
Really?
So we've been very aggressive, and the county has been very responsive in coming out and taking care of the problems, treating these bodies of water to kill the mosquito larvae. If that would, I'm not 100% what they use. We've had aerial spraying in town. We've had the ground spraying in town. I've driven around town a lot, and I've seen the Middlesex County mosquito control trucks taking the samples from the ditches along the side of the roads.
Yes, sir.
Some of our ponds. We make sure the aeration systems are working in those ponds. And people have, for a lot of times, 3 or 4 times a week, have reported incidents to me where, hey, my neighbor has a pool that hasn't been covered, in 2 years, and the water's green and black, and we send the health department out immediately to go either drain that pool or take care of the situation. So, as you said, education's big. We want the public to be informed. Anyone traveling needs to take precautions. Obviously, if you're a female and you're pregnant, you need to take extra precautions. You might want to change your travel plans.
Yes,
I
would think so.
I don't know if it's worth the risk.
No.
So it's something that we have to deal with, and it's scary. As you said, Gene, we've seen the pictures of the results.
They are. Sherie, what else
scary.
are you doing at your level with the prevention, the education, dramatizing this? I know you've been going around to the libraries with the different exhibits and boards and displays. Anything else you're doing?
We're doing education. We're working with the Mosquito Commission also on education. We're we're trying to get the message out to people. I mean, I want to reiterate what the mayor's saying. You know, the best way to not get Zika is prevention.
Yes.
You want to prevent
Yes,
breeding
ma'am.
sites, mosquito breeding sites. You know, fix your screens, eliminate sites where they breed, which are bird basins or tires in your yard, or overflowing roof gutters, or toys in your yard, or tubs, or ditches, or anything in your yard that collects water, standing water. We're trying to make homeowners vigilant about
Right.
about not having breeding sites in their backyard, because prevention is really the only way. In light of the fact that there is no vaccine,
Yes, ma'am. Yeah.
prevention is the only way that we can prevent getting Zika. And so we're trying to partner with residents so they can be involved in this process. It's not only Zika, there are other mosquito-borne infections, West Nile virus, chikungunya.
Right. So
it's important to have buy-in from residents so they're responsible for their own health as well. And one other thing that we didn't mention is
yes.
the way that mosquitoes get Zika is by biting a person with Zika. So
okay.
if you have a resident who has come back from a place where there is Zika, Puerto Rico, Brazil, Dominican Republic, any of the many countries in South America,
Right.
and they have gotten bitten by a mosquito there, it's important for them not to get bitten by a mosquito here, because that's how it gets introduced into the mosquito population in New Jersey. So currently there is no Zika in the population of mosquitoes in New Jersey, and a really important point that I want to make is not to get it into the mosquito population in New Jersey. So if people travel to areas where there is active Zika, when they come back here, they need to be really vigilant about not getting bit by a mosquito here.
Okay, thank you. Sherie, I don't want to put you on the spot, but in the past few years, we've had flare-ups of various other viruses and various other illnesses, H1N1, West Nile, and they seem to drop off the scope. They go away after a while, or they get diminished in attention. Anything like that in the future for this virus? Or you don't know? I don't want to put
I
you
had a
on
crystal
the crystal ball.
ball.
What next year would bring? Is
So
it likely to be,
so
and I know
far-
I'm asking you to project, but I'm just
Yeah,
wondering.
I can't make a projection on that. And so far, the devastation to pregnant women and their children is enough, is making enough of a mark that
that will keep attention.
I would
Keep
be
generation, yes.
glad if it dropped off into the face of the earth tomorrow.
One last question, if I may. Once you're bitten, do you have immunity?
It seems that way. I mean, the World Health Organization, the CDC, seem to imply that once you're bit, once you have Zika, you will have immunity to future cases. The only catch there is only 20% of people know they have Zika.
yeah.
So if you're one of the 80% that doesn't know you've had it, then you won't even know if you have immunity to it.
But if you have immunity, is it still possible to communicate it by sexual contact or by a transfusion, or you don't know? If you have the immunity, can you still transmit it to somebody else?
You won't get it again. If you
won't
have
get it.
immunity, you won't get it again.
You won't get it again.
So you
Okay.
won't be able to transmit it because you won't get it again.
Okay, I got you. Okay, thank you very much, Sherie. Before you go, Sherie, could you just give us a few points of information about how to contact you in your office?
Yes.
Phone
I
number?
would love to.
Who would people call?
So
And we'll put this on the screen.
Yes. If to contact our department, the direct number is 732-745-3100.
Okay.
Just ask for somebody to give you information on Zika virus.
Okay.
By website, it's www.middlesexcountynj.gov, and just search Zika. Once you get there, you'll find great resources and links to the CDC and other places where you can get updated information on Zika, travel information, updated case counts.
Okay. Okay, thank you.
Okay.
Mayor, one saving grace, I think, is the cool weather is about to descend upon us, which should certainly put a lower profile on this virus.
But people are still going to travel to warm
Right.
weather over the winter and come back. So I don't know, Gene, if that's an accurate. I still think we need to be vigilant.
Be vigilant,
with the
okay.
people who travel, and I encourage all residents of Old Bridge to walk their property and find any sign where water is accumulating and fix it or take care of it, and to report any, if you have any problem areas in your neighborhood, let me know, and I'll pass that information on to the proper department, and they'll take care of it. Gene, it's scary whenever you talk about disease, and
Oh yeah.
so we really need to stay focused with this and stay alert, stay vigilant. I know people are busy. There's a lot going on.
Yes.
But this is important. The last thing you want to do is have somebody get infected, especially a
With these
female.
consequences.
With
Yeah.
these
With these
consequences
consequences.
that,
All right.
these newborns are going to be around for a while.
Yes. Okay. Well, thank you, Mayor. And Sherie, I'd certainly like to thank you for coming in today. We appreciate you taking your time. You've been very helpful, and folks, I hope Ms. Wolpert has communicated to you the importance of being vigilant about the Zika virus and shed some information and some light on the information that you can find useful. And again, thank you for coming in.
Thank you for inviting
And
me.
folks, this has been Old Bridge Outlook for this time. We'll see you again next time. I'm Gene McLaughlin. Take care.